very warm welcome to all our viewers and welcome to a new edition of Africa Today, our program bringing you all the latest news and events happening inside the Black Continent. My name is Angie Meher and I'll be joining you for today's edition. And of course, as usual, we start straight away with a look at some of the news making the headlines all around the African continent, starting with news from home, where Egypt stating that it categorically rejects the commencement of the second filling of the Ethiopian dam, of which Ethiopia notified Egypt earlier on Monday. The step by Ethiopia could escalate tensions with downstream countries, Egypt and Sudan, who have raised the issue with the United Nations Security Council, which is set to convene this week for further discussions. We have more details in this story.
Irrigation Minister Mohammed Abdel-Aty voiced Egypt's rejection to Ethiopia's step to start the second phase of filling the reservoir of the Grand Ethiopian Renaissance Dam, GERD. This comes after Abdel-Aty received on Monday an official letter from his Ethiopian counterpart confirming that Ethiopia started the second filling phase of the GERD reservoir. In response to Monday's letter, Abdel-Aty sent an official letter to Ethiopian minister voicing Egypt's categorical rejection of Ethiopia's unilateral act. Abdel-Aty said that this act represents a clear and dangerous violation of 2015 Declaration of Principles signed by 3 countries. The Ethiopian step is also a violation of the international laws and norms that regulate the projects based on the mutual basins and international rivers, including the Nile River. Egypt reiterates that Addis Abeba's step is a dangerous update which uncovers again Ethiopia's bad intentions and insistence to take unilateral procedures to impose that fait accompli and fill and operate the Renaissance Dam without an agreement that takes into consideration the interests of the 3 countries and limits this dam's harm on the 2 downstream countries. The spokesman added also that this Ethiopian step will exacerbate the state of crisis and tension in the region and will lead to the creation of a situation that endangers security and peace on the regional and international levels. Egypt and Sudan has reiterated rejection of the second filling of the GERD, which Ethiopia builds on the Blue Nile, unless the 3 countries reach a legally binding agreement on the dam.
And for more news, this time moving to the latest situation in Ethiopia, where rebels in Ethiopia's war-torn Tigray region have accepted a ceasefire in principle, but have posed strict conditions for it to be formalized. Notable among those conditions was the withdrawal from the region of Eritrean forces, as well as fighters from the neighboring Ethiopian region of Amhara, who have been supporting the Ethiopian army during the 8-month-long conflict. We have more details in this report.
Ethiopian Prime Minister Abiy Ahmed said on Monday that recent withdrawal of troops and officials from the northern Tigray region should not be viewed as a sign that the government side lost the war. Ahmed said that 8-month conflict against the Tigrayan rebels had weakened them. He said also that national army still had the capacity to fight, but stressed the need for there to be peace in order for Ethiopia to develop. In an address to Parliament, he did not respond to the rebel TPLF's list of the preconditions for that to be a bilateral ceasefire. Hundreds of thousands of civilians in Tigray are experiencing famine-like conditions as a result of the conflict, and aid agencies are appealing for the unhindered access.
Prime Minister Dr. Mustafa Madbouli said that Egypt has produced 1 million doses of the coronavirus vaccine manufactured by the Egyptian holding company for biological products and vaccines known as Vaxera. He added in a press conference that Egypt's daily production for the vaccinations currently is 300,000 doses, and the government is discussing with China the doubling of the raw materials to import to raise the country's daily production to about 600,000 doses. We have more details in this story.
Prime Minister Mustafa Madbouli said on Monday that producing vaccines locally is a matter of national security, as there is a possibility that animal vaccines may be required to keep the coronavirus at bay. Madbouli's statement came as he visited the state-owned Vaxera complex factory in Sikha, October City, along with Minister of Health Hala Zayed, to witness the first stage of producing the Chinese Sinovac vaccine locally. The new complex can produce normally 3 million doses of different vaccines simultaneously. Madbouli revealed that the government was working to finalize a number of agreements with international situations in several countries to produce 8 vaccines that Egypt needed, including vaccines for newborn babies as well as other vaccines needed in the country to create self-sufficiency. He also stated that the President Abdel Fattah el-Sisi gave his directives to produce the vaccines locally due to the delay in the delivery by some of the companies which Egypt contracted to get vaccines as a result of the huge global demand for vaccines. Egypt received its first shipment, 1,400 liters of Beijing-based Sinovac COVID-19 vaccines raw material in May, which is enough to manufacture 2 million doses at Vaxera. The 2 million shots are a part of the wider deal with the Chinese company to produce a total of 40 million doses by the end of 2021 in Egypt, which aims to vaccine 40% of its 100 million plus population by that time. The government is also in talks to locally manufacture the British AstraZeneca vaccine at Vaxera's factories.
We're now delighted to be joined over the telephone by our guest who's joining us this afternoon, Dr. Tariq Ibrahim, the Professor of Surgery. Dr. Tariq, a very good afternoon to you, sir.
Yeah, hello, good afternoon.
Thank you for joining us, Doctor. Now, the global coronavirus pandemic has, of course, been coupled with a boom in the pharmaceutical sector, and Egypt has now announced the beginning of its production of the Chinese Sinovac vaccination. How do you see this important step in the fight against the pandemic?
Definitely, this is a very important step for the fighting against the pandemic, and I think this step also should be done earlier than that. And I think definitely this is a very good achievement from the government.
Absolutely. Now, the current production capacity is about 1 million doses of the corona vaccine, the Chinese vaccine. How do you see this announcement and Egypt's aim to increase its production capacity by importing more of the raw materials?
Yes, I think this is 1 million is very good number for production as a start, and still we need more. And I think if Egypt increases its capacity to do more, it will be much better. So we can achieve a larger number of people vaccinated, which can help in controlling the situation, and we can be ready for the next, or the fourth wave, which is expected at the beginning of winter.
Right. Doctor, let's talk a bit about how the progress of the vaccination campaign, as you see it in Egypt, especially with now more and more people applying for the vaccination and actually indeed some people have already received their 2 doses or all the doses they need of the vaccine.
I think the campaign is going very well, and I think many people now applied for the vaccination because they started to know the benefit of the vaccine, because yes. People were reluctant to apply. A lot of people, they didn't thought about applying. I think now you can see many people are asking how to apply. Many people are asking how we can get this vaccine, and this is the proper way. This is what we should go on.
Right. Dr. Tariq, also, it's very important to discuss the Egyptian infrastructure that is allowing the capability of the mass production of the vaccinations, not just to fulfill our need of the vaccine in Egypt, but also to become an African hub to export to other African countries. How important is this part of the production of the vaccination?
Yes, definitely, this is very important.
Yes.
And Vaxera is an active institution in Egypt since the 40s of the last century. So definitely, we had a very good experience, and this experience of the Egyptian scientists and workers in this field, it can help us even not only to help Egypt, also to help other Africans and surrounding countries which are in need of this vaccination.
Yes, indeed.
Definitely, this is a very good step, yes.
And Doctor, how do you see in general, other African countries' access to the vaccination? We have seen in many meetings President Abdel Fattah el-Sisi calling for more access of the vaccination to African nations which are lagging behind compared to other countries?
Yes, definitely Africa is lagging even behind Europe and the Far East and Americas. So I think there is a very good opportunity for Egypt to help other African countries and to start its vaccination program production, and I think we are capable as a country to go for this road and to help African countries. Yes.
Indeed, it's very important as well. Right, you mentioned the coronavirus expected wave at the beginning of autumn, winter, the upcoming wave. Tell me scientifically, why do we expect a fourth wave in Egypt? Is it because of the weather fluctuations, or because of the strains of the virus, or because of the virus becoming more resistant?
You know, it's a kind of fluctuation of the weather, a kind of new species from the virus, and also you can start to have some resistant strain. So it is expected. This is why you expected, like the third wave also were expected. So definitely, if this wave is coming from the virus we know that is vaccine was done against it, then we can handle this wave in a much proper way, and we will not have more patients, you know. And I think now we have the experience how to handle the patients. I think with the third wave, hospital-wise, medical system-wise, we could cope very well with this third wave, with the experience, with the knowledge from other countries we share. So I think the fourth attack, we will be very, very ready to this attack, and we will be controlling the wave in much better way.
Doctor, do you see that the vaccination and the fact that more and more people are getting vaccinated will also help in the limiting of the spread of the virus in the fourth wave, the expected coming wave?
The ideal story that you will have vaccinated people, and when most of the people are vaccinated, if you can reach the 2/3 of the population, this is much better. If you reach 1/3 with active people in the society, then you can control the waves, because at least whenever you go, you meet vaccinated people. But if you have in between non-vaccinated people, these are the source of the
spread
pandemic.
Right. Let's get something clear, Doctor. Even if people are vaccinated and they become infected, what does this mean? Is it just a lighter kind of infection?
Lighter kind.
But does it differ with regards to their contagiousness? If you're vaccinated, are you more contagious or less contagious, or it doesn't make a difference?
No. Definitely, if you are vaccinated, you are less contagious. You definitely you don't. Even if you have the infection, it will be mild, and it's much better, definitely.
Right.
And you can see it in countries where they are most of the people vaccinated. They go now with no mask. They go more free.
Indeed. Right. Doctor, let's talk a bit about the new variants that have struck all over the world. We've seen
that everyone has started to go with no mask because most of the people are vaccinated.
Yes. Doctor, I wanted to ask you about the Delta variant, for example, which has really taken a toll. We've seen so many countries worldwide, struggling and suffering because of the mutations of the virus and the new variants of the virus. How are the vaccines that are available capable of fighting these new variations of the virus, or is there still need to further develop the vaccine?
I think we need further development of the vaccine. But the mutant virus, I think many countries now are ready for the mutant virus. People are vaccinated, hospitals are ready, they are spotting the cases and attacking this and limit this mutated virus. And I think even with the mutated virus, the experience gained from the original coronavirus, that helped countries to combat the new mutated ones.
Right.
Yeah.
Absolutely. Doctor, let's talk a bit about Egyptian hospitals and their fight in the infections. We've seen really the upgrading of facilities in Egyptian hospitals, how the actual protocols for treatment of the symptoms of the virus have also been changed over time, and more understanding of how to treat patients with the coronavirus has really been reached amongst Egyptian doctors and medical practitioners as well as nurses. How do you see the rate and the capabilities of the medical staff all across the country?
I think the medical staff, doctors, nurses, physicians, the medical system, hospital, they gained a very good experience, and you can see it. You can see the result and how they take good care of the patient from the first, the second, the third wave. And I think the country was very, very successful regarding the third wave, hospitalization for the patient, control of the infection. I think we did very well, and even we were not in a panic like with the first and second one.
Do you also see that the citizens themselves have changed their attitude? Are they more understanding? Are they practicing precautionary measures better than before, which is helping in the limiting?
I think most of the people, they started to be cautious and they started to take measures against the infection. But definitely some people are reluctant, which is these reluctant people really can affect the proper, can affect people trying to make things in a proper way. Because if you find somebody coming with no mask in a crowd population, it's not good, you know. But definitely the attitude of the people are much better. They are more taking care. They are more understanding the situation. They are more understanding what to do. And I think you yourself and your colleagues and the government, they have to push people more toward for the vaccination. They have to take care, because it's a group of measures. We take it all together: vaccination, taking care of the infestation, early notification, early treatment, early what you call it, early isolation. This is very important altogether. Yeah.
Absolutely. Right. I'd like to thank you very, very much, Dr. Tariq Ibrahim, the Professor of Surgery. Thank you so much, sir, for joining us this afternoon and for your insight. Ladies and gentlemen, that's all the time we have for today's edition of Africa Today. You were in the company of myself, Angie Meher. Many thanks for joining us.